If there is one phone call that every horse owner hopes they never have to make, it's the call to the veterinarian because their horse is colicking. Colic is one of the most common equine emergencies in the world. It affects horses of every breed, every age, and every discipline. Whether you own a retired pasture companion, a barrel horse, a dressage horse, a trail horse, or a racehorse, colic is something that every owner needs to understand because it can become life-threatening very quickly. The good news is that while not every case of colic can be prevented, research has shown that many cases are linked to management practices that we can actually control. The way we feed our horses, how much they drink, how often they move, how we introduce dietary changes, and even how closely we observe them each day can all have a major impact on their digestive health. Today, we're going to discuss some of the most effective ways to prevent colic in horses. We'll explain why these recommendations work, how they support the horse's digestive system, and what practical changes you can make around your own barn to help reduce your horse's risk. We'll also discuss the early warning signs of colic that every horse owner should recognize because catching colic early can sometimes make all the difference. So let's get started. One of the biggest misconceptions about colic is that it's actually a disease. Colic is simply a medical term that means abdominal pain. That pain can be caused by many different problems inside the digestive tract. A horse may develop gas colic and impaction, intestinal inflammation, sand accumulation, displacement of the intestines, or in some cases, a life-threatening twist that requires emergency surgery. Because there are so many possible causes, no single product, supplement, or management practice can completely eliminate the risk. However, veterinarians consistently agree that good daily management can significantly reduce the likelihood of many common forms of colic. The first and perhaps most important step in preventing colic is making sure your horse always has access to clean, fresh water. Horses have an incredibly large digestive system that depends on adequate hydration to keep food moving normally through the intestines. When horses become dehydrated, the contents of the intestines become drier and harder to move. This increases the risk of impaction colic, especially during the winter months when horses naturally tend to drink less water. Many owners assume their horse is drinking enough simply because the water bucket is full or the automatic water is working. Unfortunately, that isn't always the case. Horses can significantly reduce their water intake without owners immediately noticing. If you use buckets, pay attention to how much water disappears each day. If your horse suddenly begins drinking much less than normal, that may be an early warning sign that something is wrong. Some horses also become picky about water while traveling. They may dislike the taste of unfamiliar water sources at horse shows or overnight events. Many experienced competitors bring water from home or gradually flavor their horse's water with a small amount of apple juice, so the taste remains consistent wherever they travel. Encouraging horses to drink while away from home is one of the easiest ways to reduce travel-related colic. Along with monitoring water intake, it is also helpful to know how quickly to evaluate hydration. Healthy horses should have moist gums that feel slippery rather than dry or sticky. Veterinarians also often perform a skin test, although this test becomes less reliable in older horses because aging skin naturally loses elasticity. If you ever suspect dehydration, contacting your veterinarian is always the safest option. The next recommendation may sound simple, but is one of the most important principles in equine nutrition. Avoid sudden changes in your horse's diet. Inside your horse's hindgut live billions of beneficial microorganisms that digest fiber and help produce energy from forage. These microbes are highly specialized and adapt to the horse's regular diet over time. When feed is changed suddenly, those microbial populations don't have enough time to adjust. The result can be digestive upset, excessive gas production, altered fermentation, and increased risk of colic. This is why veterinarians recommend introducing new hay, grain, or pasture gradually over 7 to 14 days whenever possible. Instead of switching overnight, slowly increase the amount of the new feed while decreasing the old hay each day. This gradual transition gives the digestive microbes time to adapt and helps maintain a healthier digestive environment. Another extremely important factor in preventing colic is providing enough forage. Horses evolved as grazing animals. In nature, they spend approximately 16 to 18 hours each day eating small amounts of forage almost continuously. Their digestive systems were designed for a nearly constant flow of fiber. Modern management often looks very different. Some horses receive 2 large meals each day and spend many hours with nothing to eat. Long periods without forage can negatively affect both the stomach and the intestines. Whenever possible, horses should have nearly constant access to forage, unless a veterinarian has recommended otherwise for a specific medical condition. Slow feed hay nets, hay feeders, and multiple smaller meals throughout the day can all help mimic more natural grazing behavior. Not only does this improve digestive health, but it can also reduce boredom and undesirable stable behaviors. Exercise also plays a surprisingly important role in digestive health. Most horse owners think of exercise as something that benefits muscles, joints, and cardiovascular fitness. However, regular movement also stimulates normal intestinal motility. Horses that spend more time walking, grazing, and moving around their pasture generally have healthier digestive function than horses confined to stalls for longer periods. This doesn't necessarily mean every horse needs intense exercise every day. Even regular turnout allows horses to walk, graze, interact with other horses, and keep their digestive tract moving more naturally. If your horse must remain on stall rest for medical reasons, discuss management strategies with your veterinarian, because stall confinement itself can increase the risk of certain digestive problems. Stress is another factor that is often underestimated when discussing colic prevention. Think about everything that changes when horses travel to competitions. They spend hours in a trailer. They arrive at a new environment. The water tastes different. The hay may come from another supplier. Their turnout schedule changes. Their feed schedule may shift. They encounter unfamiliar horses, unfamiliar people, and significantly more activity than they experience at home. For many horses, these changes create considerable stress. Stress may contribute to reduced water intake, decreased appetite, gastric ulcers, and digestive disturbances that can increase the risk of colic. Whenever possible, try to maintain your horse's normal routine while traveling. Bring hay from home, encourage drinking, feed on a consistent schedule, and provide opportunities for hand grazing or walking whenever it is safe to do so. Another important piece of the puzzle is parasite control. Years ago, horse owners commonly dewormed every horse every 2 months, regardless of whether the horse actually needed treatment. Today, veterinarians recognize that this approach has contributed to widespread parasite resistance. Instead, many veterinarians now recommend strategic deworming programs based on fecal egg count testing. These tests identify horses carrying higher parasite burdens, so treatment can be targeted appropriately. Your veterinarian can help develop a parasite control program that fits your horse, your property, and the parasite risks in your geographic region. Routine dental care is another management practice that indirectly reduces colic risk. Healthy digestion begins in the mouth. Horses need to thoroughly chew forage before swallowing it. Proper chewing reduces feed particle size and allows the digestive tract to process nutrients more efficiently. Sharp enamel points, missing teeth, loose teeth, wave mouths, hooks, or other dental abnormalities can interfere with chewing. Horses with painful mouths often swallow much larger pieces of hay that are more difficult to digest. Routine dental examinations help ensure your horse is chewing feed as effectively as possible. Feed quality is equally important. Never feed moldy hay, spoiled grain, or contaminated feed. Mold can produce toxins that negatively affect a horse's digestive system, and spoiled feed may reduce intake or contribute to illness. Feed storage also deserves attention. Grain rooms should always remain securely closed because horses that gain unrestricted access to concentrated feed can consume dangerous amounts in a very short period of time. Grain overload can lead not only to severe colic, but also to life-threatening laminitis. Many horse owners also wonder whether digestive supplements prevent colic. There are hundreds of digestive products on the market today. Some contain probiotics, others contain prebiotics, yeast cultures, digestive enzymes, buffers, or various herbal ingredients. While some horses may benefit from certain supplements under veterinary guidance, there is currently no supplement that can guarantee a horse will never develop colic. Supplements should always be viewed as exactly that, supplements. They should never replace proper forage, clean water, regular exercise, gradual dietary changes, routine veterinary care, or good overall management. One recommendation that experienced horse caretakers frequently emphasize is consistency. Horses thrive on predictable routines. Feeding at approximately the same time every day, maintaining regular turnout schedules, introducing changes gradually, and minimizing unnecessary disruptions all help support both physical and mental well-being. The digestive system functions best when daily management remains consistent. Now let's discuss something every horse owner absolutely needs to know: the early signs of colic. Many owners imagine horses violently rolling across the ground. While that certainly can happen, the earliest signs are often more subtle. Your horse may simply stop eating. They may stand quietly in the corner of the stall. They may repeatedly look at their sides. Some horses paw occasionally without showing severe pain. Others stretch as though trying to urinate. Some repeatedly lie down and stand back up. You may notice fewer manure piles than usual. Some horses begin sweating despite cool weather. Others develop an elevated heart rate or simply appear unusually restless. Every horse responds differently to pain, which is why knowing your horse's normal behavior is one of the best preventative tools you have. If something simply doesn't seem right, trust your instincts and contact your veterinarian. One of the most valuable habits you can develop is performing a quick daily health check every time you visit your horse. Notice whether they greet you normally. Observe whether they finish their hay. Pay attention to how much water they have consumed. Look at the manure in the stall. Watch how they walk. Notice whether their attitude has changed. These observations take less than a minute, yet they often allow owners to recognize illness long before it becomes an emergency. Finally, it is important to remember that even the best horse owners sometimes experience colic. You can provide outstanding nutrition, excellent veterinary care, unlimited clean water, regular exercise, careful parasite control, and still have a horse develop a serious intestinal problem. Some forms of colic simply cannot be prevented. This doesn't mean you failed. The goal isn't perfection. The goal is reducing risk as much as possible while recognizing problems early enough to give your horse the best possible chance of recovery. The reality is that preventing colic isn't about one magic supplement or one miracle management technique. It's about consistency, doing dozens of small things correctly every single day. Fresh water, high quality forage, regular movement, gradual dietary changes, routine dental care, strategic parasite control, careful observation. Together, these simple habits create a healthier digestive system and significantly lower the risk of many common forms of colic. If there is one takeaway from today's video, let it be this: know what is normal for your horse. No one spends more time with your horse than you do. This means you are often the first person who will notice when something changes. Recognize those changes early, and calling your veterinarian promptly may be one of the most important things you ever do for your horse. Thank you so much for joining us. And remember, I am not AI. If you listen closely, you can hear me breathing.